Now, chickenpox can be very dangerous if you have a child or an adult in your house who is immunocompromised, who is on chemotherapy, because chickenpox can be deadly for an immunocompromised person.
Hello, welcome back here on Pediatrics To-Go. So today we're talking about chickenpox. I'm Francisca, and with me here is Dr. Ekuase Sanusi, your trusted pediatrician, and I'm going to give her, leave the stage for her to, enlighten us as usual. So, hello, Dr. Ekuase, how are you doing?
Hi, Francisca. Thank you for being here. And we're talking about chickenpox because it's one of those childhood diseases that in the past we used to see a lot of, but since the vaccine was introduced decades ago, we're not seeing it as often. But in Nigeria, we still see it once in a while just because we do have some children that are never immunized and they're at risk to get chickenpox. Now, chickenpox is a virus, and the virus is called varicella. And when children have chickenpox, basically they have a prodrome. It takes about anywhere from a few days to up to 7 to 10 days for a child who's been exposed to chickenpox to develop it. And usually it could start as a fever, cold symptoms, or just not feeling well, and then the rash comes up. And the rash usually looks like vesicles, like bumps on the skin that are filled with fluid. And it tends to be, sometimes it's itchy, sometimes it's not. Some people, when they have chickenpox, they might have just 3 or 4 lesions, and then it disappears for a few days and then it goes away. But in general, chickenpox is one of those, it's very contagious. It's one of those childhood diseases that, because we're not seeing it that often, sometimes it can get misdiagnosed. But the general course of chickenpox is usually 7 to 10 days. The rash comes, and when children have the rash or when they have the fever, they're still very contagious. But once the fever is gone and then the rash starts to scab, and most, like 80 to 100% of the lesions are scabbed over, like generally, then they're not contagious anymore. When I was growing up, it was very common to get chickenpox. In fact, my brother and my sister and I, we all used to play together. We all had it at the same time. So we were in quarantine in one of our rooms, all together.
And then contracted each other.
And the honest truth is, personally, I was like, my children will get the chickenpox vaccine. They'll never have chickenpox, because when I look in the mirror every day, I see scars from my chickenpox from when I was 5 years old.
I have one here.
And and I told my children, I said, I made sure that you guys don't have any scars, because I wasn't immunized as a child. And at the end of the day, I'm like, oh, my children must get immunized, and because it's important. But anyway, chickenpox is usually a very mild illness, and it gets children have it and they get better, and then they're fine. And the treatment usually is lots of fluids. If they have a fever, give ibuprofen, and it's self-limiting. It goes away by itself, but we don't want to give it to anybody. So if your child has chickenpox, or if you have anybody in your house with chickenpox, stay at home, rest, drink lots of fluids, and feel better. Now, chickenpox can be very dangerous if you have a child or an adult in your house who is immunocompromised, who is on chemotherapy, because chickenpox can be deadly for an immunocompromised person. But if you don't have that kind of, if there's nobody around you that has chickenpox, like I remember when I was in training in California, there was a chickenpox exposure to the patients. One of our, somebody that worked as a health provider had chickenpox, and all the children in the hematology ward had to get vaccinated with the immunoglobulin, just because it can be a problem for immunocompromised people. But otherwise, it's a self-limited illness, childhood illness, and children shouldn't be getting it now because they should be immunized. You get your vaccines at 1 year and 4 years old. You get the booster, and children are immune for life. Now, the side effects of chickenpox, if you get it as a child and you're fine, when you're older, like in your 50s or 60s, the virus can stay in the nerves, and when you have a time of decreased immunity,
it comes back.
It can come back, and that's called shingles.
Oh,
So you can get shingles, which is like crops, like vesicles. They're like chickenpox blisters, but they're like blisters or vesicles that just pop up. First of all, you feel pain on the skin, and then next minute they come up, and it's usually in the dermatomes or the nerve endings underneath the skin. So you might have it on one side of the body, and you have like a very painful rash.
wow.
And those are older people. Some not too old people can get it too. But when you get that and you have a history of chickenpox, usually you see your doctor, they put you on acyclovir, which is a chickenpox medicine, and you feel better and it goes away.
When I had chickenpox, I don't think I took medicine. All I had was this lotion. There's this popular lotion we have in Nigeria. Is that, we call it calamine lotion.
Oh, calamine lotion,
That's like
yes.
popular. It has this smell, and then,
Yes.
they tell you to go naked, and they put it because the itch is always so,
It's itchy, yes.
very, very, very uncomfortable, and you can't
Yes.
sleep because. So when you said mild, I'm like, chickenpox is not a mild disease at all. I mean, it's very traumatic.
If you are itchy, then you take Benadryl or an antihistamine. That helps with the itching. But Caladryl, people use that, and really, if you feel better using it, that's fine. But the oral anti-itch medicine is actually better to control the itching, and you feel much better. But just drinking lots of fluids and taking your pain medicine, if you have any pain or discomfort, that helps. But the goal is, I tell people, if you can drink and drink and drink and pee and pee and pee, if you're peeing like 7 to 10 times a day and you have any illness, you're flushing it out every time you're passing urine. So let the goal be drink as much as you can, pee as much as you can, and then you get better sooner than later.
There's this, I don't know if you know about this superstitious belief when people have chickenpox. They'll tell you that, don't run away from them. If you run away from there, you contract it, and then it'll be worse than the person that has it. So
a lot of these beliefs or
Yeah.
statements, and it's obviously people did not really understand.
What's the difference between chickenpox and measles?
Oh, measles is also a very contagious childhood illness, but the vaccine is there, so there's really no reason for people to be having measles. But they're all they're all different types of viruses. They're very contagious, and because there's vaccines, we're not seeing that. And all these viruses, they can actually have side effects. Some people have had chickenpox and have actually died from just having chickenpox.
But wait, is it
That's
possible to have the vaccine and still have chickenpox?
Yes, it's possible, but you have a milder illness. But some people have actually died from chickenpox because they ended up with pneumonia, especially when older people get it.
But yeah, that's why they said if you have chickenpox at an older age, you are more at risk.
Yes, you're more at risk. But if you're a child and you have chickenpox, you're fine.
There's no
But
problem.
when you're an older person, you can have pneumonia. And I mean, we know people that have died from chickenpox when they got it in adult years. And that's why it's important to get the vaccine. And when you get it as a child, you have lifelong immunity, so you don't need the vaccine anymore. And if you are applying to a job and they're saying, go take chickenpox, check your serology or antibodies to see if you had chickenpox. Most people that have had it, they'll still be positive. They'll still have antibodies to it.
Oh, wow.
It's a lifelong immunity. Yeah, just that you can get the shingles.
Wow.
And and that's the other name is herpes zoster, but that's one of the side effects of having had chickenpox. But that's chickenpox. Yep.
Now, so if you get tested, you can still be positive.
Yeah, that means you have antibodies. If you do serology is checking for antibodies, and if you are positive, that means you are not chickenpox positive, you are antibody positive, so you are still immune once you have the chickenpox, you are immune for life.
Wow. Now, I didn't even know that.
Yeah.
Did you know that? No, you didn't. So thank you very much for joining us. So brings us to the end of chickenpox as a whole. So until next time, see ya. Bye.
Bye.